Okay, I'm just gonna go and check my provider's orders. It looks like this patient has a central line placed. She did call to say that it was coming loose, so we do know that we need to change it every 5 to 7 days or when it starts coming loose. It hasn't been in the 5 to 7 day range, but since it's loose, we're gonna go ahead and change it for her today for Miss Jessica. Alrighty. Hello, good morning. My name is Elise. I'm gonna be your nurse today. Can I verify your first and last name and your date of birth?
Yeah, Jessica Lowe, 7/14.
That sounds great. Well, Jessica, I did see that you pressed your call light saying that your CVAD dressing came loose. Thank you so much for pressing that call light. We do want to change it every 5 to 7 days or when it starts getting loose. I just want to make sure, do you have any allergies?
No.
Okay, wonderful. I'm going to go ahead and gather my supplies to get that CVAD dressing change. Is that okay if we do that today?
Mm-hmm.
Okay, wonderful. I'm going to go gather my supplies. I'll be right back. Alrighty. Okay, I have all of my supplies here. So what I'm going to be doing, I'm just going to be taking off the dressing that's already on there and then changing it. It is a sterile procedure, changing your CVAD dressing. I will need you to kind of stay still and try and not touch anything because I will be sterile and I would hate to break the sterile field. Also, since the subclavian area is very high risk for infection, we are both going to be wearing masks, and I'm going to have your head turned away and have you not speak, just so that we can keep the area as little risk for infection as possible. In real life, I would not be talking, but for the sake of this, I will be talking just to explain the procedure and everything else. Does that sound good?
Mm-hmm.
Alrighty, let's go ahead and get our masks on. And this one is just for you. Okay, make sure all of your hair is out of the way. Just gonna turn your head this way. Perfect. Alrighty. Okay. I would provide some patient privacy because I will be needing to access and move her gown, but get some gloves on. Okay, I'm just going to be moving your gown down a bit just so I can access your dressing. Alrighty, so it does look like it's coming a bit loose. So I'm just going to take off the dressing from distal to proximal. Okay, I'm just going to be inspecting the site. It doesn't look like there's any redness or any dried blood, swelling, no discharge. And it looks like it's out about 1.5 inches or so, maybe about like 4 centimeters. And if there was anything concerning, any like redness, swelling, discharge, anything, I'd notify the provider. But since there's none of that, I think we're good to just go ahead and do a normal dressing change. Alrighty, so I'm just gonna throw this away and toss my gloves and hygiene. And get started. Okay. gloves. I have my gauze. Since there's no dried blood or anything, I won't need my alcohol swabs. Need that. I'm going to use the sterile gauze to pick up the line, and then I will simulate scrubbing it clean. So I'm now going to come over here to the dressing, pick up the line, and then I will be scrubbing 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, I'm gonna let this dry. I'm done with these supplies. Just gonna leave them over there. Okay, the dressing is, the area is now dry. I would be putting on a skin protectant, but since that's not needed right now, I will not be doing that. So we're gonna go ahead and place on the dressing. We're gonna make sure that the center is covering over the insertion site. And secure that down. Okay. Make sure that the insertion area is nice and secure. I'm gonna grab my pen. I'm gonna put the dates, time, and initials. And place it just on the side of the dressing so you can still see the insertion site. Okay, and I'm just gonna go ahead and clean up my area. take off my gloves and wash my hands. Hand hygiene. Alrighty. Okay, Miss Jessica. You did wonderful during the dressing change. Just some things to go over again. You know, we do need to change it every 5 to 7 days. Here, I can grab that mask for you. You do want to change it every 5 to 7 days, so we will routinely come by and do that. But if it does start to get loose during that time, I do want you to do what you just did and press that call light so we can come and change that for you. If you start getting any signs of infection like fever, chills, if you notice any drainage, redness, swelling at the insertion site, please press the call light and let us know. We want to make sure that the dressing is dry and clean. So if you do see any soilage, press that call light as well. And yeah, you did wonderful. I'm just going to lower your bed, make sure that you are in a low and locked position. You do have your side rail up, your bed is locked, and you do have this call light right here by your hand. So I'm just going to go ahead and document the procedure. If you have any other questions or concerns, press that call light and let me know. Otherwise, you did really great. Thank you so much.